Next, the main culprit for blisters is the fifth toe. As your foot gets hot and swells, the little toe just tends to get pushed in underneath that fourth toe. And if you've got any ridging or callousing or thick, you'll definitely get a blister in that area. So that needs to come off, and ideally a podiatrist can use a scalpel, take it off, and then you can maintain it with a lovely foot file, moisturiser, all that sort of thing, which I'll talk about later. But this is a really common, and believe it or not, it's probably one of the most common blisters that people have to pull out from. They are excruciatingly painful, and I think it's almost like, you know, the whole paper cut idea. The smaller the cut, the more painful it is. It's the smaller the area of the foot, the more painful it is. So if you've got, I would definitely be taping fourth and fifth. Sort of, if I was doing the event and I had no other, I would definitely do fourth and fifth. For those of you that are getting any blisters on the top of your toes, or if you're worried, just do all of the other four. It doesn't hurt, it only takes an extra minute to do them, and it just puts you in that, it sort of really prevents, or puts you in that much better sort of category for preventing those blisters. So we need 2 pieces of tape for each toe, and the Fix-A-Mole has these lovely grid-like squares on it. Use that as your measurement sort of tool. So you want 2 squares width for the first piece, and 3 squares for the second piece. I'll cut a couple of these. So 2 squares first piece, 3 squares second piece. Now this is the only tape that you don't have to round, because it's a bit hard with the toes to sort of get it all perfect. So I'll do the fourth and the fifth on both, and or on both feet. So the first piece of tape, which is the one that's 2 squares, goes lengthwise over the top of here. And again, just be careful about the creases, but you often can't prevent the creases with this one. It's a bit of a tricky one to get it perfect. The second piece of tape comes underneath the toe. So you want to start with the, halfway in the middle of that piece of tape, and this then comes up and rounds, and you don't want any skin showing on the side of the toes, and that piece of tape comes up and joins on the top. So the order's really important. So it's lengthwise first and then that way. Don't do it the other way around, because the flesh of the toe gets squashed, and it tends not to work as well. We've sort of tried that with a few people and it doesn't work as well. So that's your toe taping, and it's basically, for those people that are worried, I do all 4, but definitely fourth and fifth. Once you've got your toes, I'll do the other one. Sorry. So I'll do the little one just to give you an idea, because that's a bit trickier to sort of sometimes to see and to do, because they often tend to be a bit stubby or a bit sort of weird, the joy of having toes. And if you've got really little feet, you might need to cut these slightly shorter, just sort of work out from with your anatomy sort of what works for you.
Would it be best to cut those little ridges off with your
I don't, with the tape, I don't think with this one, I don't think it matters as much, no. I mean, if you really, really, really wanted to be particular, you could, yeah. And there's the toes. The only other thing that you could do, like for example, this area here, see how there's an area of skin that's sort of been left? I would ideally make sure that the length of that tape sort of married up to that. So when you're cutting it, make sure it marries up, or just put another piece of tape just across there, so you haven't got this sort of just this small gap between the skin. So a little bit more like that one there. You could get away with that. If there's any, and basically the only other taping I was going to talk about was if there was any other areas that you were sort of getting niggles with. This area here can sometimes be a bit of a concern, and the way that you tape this is you basically sort of shape the tape, you sort of curve the top of the tape, and you just put one piece to curve across here, and then one piece to sort of to overlap there. And that's sort of an area that I wouldn't necessarily tape all the time. It would just be if you tend to have problems there. The heels and the toes, if I was doing the event, I would tape them regardless every time I did it.